Hello, my name is Paisley Robinson, and I'm going to be performing an IV start and a hanging of fluids. I'm going to make sure that I follow my general principles and safety practices, along with my 3 checks of medication and my 11 rights of medication. So I would enter the patient's room and I would perform hand hygiene. I'm going to make sure that I use 2 patient identifiers to identify them, and then I'm also going to assess for allergies. So I perform hand hygiene. I've already checked all of the expirations on all of my packaging, and everything's within date. So I would go ahead and open my new tubing. And this is my primary tubing. And then I'm going to go ahead and spike the bag, and I'm going to make sure that I don't contaminate or touch that. So I'm going in at a twist motion, and then I am going to hang my fluids. And then I'm going to prime my line. I'm going to squeeze this until it's about halfway full. I'm going to remove the cap. And I'm going to prime my line until all the air bubbles are out. And I've checked there's no air bubbles. I'm going to go ahead and replace my cap. And I'm going to close the line. So I'm going to perform hand hygiene. Put my gloves on. And then I'm going to prime my J-loop. So I've also checked the expiration on this. I'm going to go ahead and open it. Going to hook up to normal saline. And I'm going to remove the cap and prime my line. I'm going to make sure that I put this back into the clean package. Without contaminating. Then I'm going to go ahead and assess my patient for the appropriate site. I'm going to be using the site on the hand, and then I'm going to go ahead and tie the tourniquet. And I'm going to go ahead and feel the radial pulse. Good. I'm going to palpate. Once I have the vein, I'm going to scrub and clean the site. I'm going to allow that to air dry. And then I'm going to examine my catheter, make sure the bevel's up, and I'm going to make sure there's no abnormalities of this. I'm going to go in at a 10 to 15 degree angle with the bevel up. And I do have blood return, so then I'm going to go ahead and ascend the catheter, making sure that I don't let go of it. I'm going to initiate the safety and dispose of it in the sharps container. And then I'm going to go ahead and get my flush. Pick it up. I'm going to go ahead and pop my tourniquet. I'm going to pull back, make sure I get blood flow, and flush, assessing the site, making sure that there's no abnormalities, any kind of redness or swelling, and there is not. Then I'm going to go ahead and get a piece of tape to anchor my catheter, making sure that I don't touch the insertion site, and now I can let go. And I'm going to go ahead and get my Tegaderm. Place it over the IV site. I'm going to make sure that I date, time, and initial where I stuck and on the Tegaderm. And then I'm going to go ahead and hook that up. Right. And go ahead and have my alcohol here. And I'm going to go ahead and hook them up. So I'm going to remove, and I have flushed, and it is running good, and I've examined the site. I'm going to make sure that I scrub the hub. And then I'm going to remove the cap. Hook up my fluid. I'm going to undo it and make sure I have the appropriate drip rate. And then I'm also assessing the site for any kind of redness, any abnormalities. I'm going to go ahead and get another piece of tape. Put that down. So I'm going to ask my patient how they're doing, if they're having any pain with that. They're doing good, so then I'm going to go ahead and remove my gloves. And I'm going to perform hand hygiene, and then I'm going to immediately document the medication and the IV that I started, and then I am going to make sure that I come back and evaluate my patient and make sure that the IV site is still flowing good and that they don't have any issues. And that is it.